Welcome back. We are continuing to get answers to your questions and concerns about the coronavirus and the vaccine. So let's get right to it. Joining me now live to answer some of those questions is Dr. Ram Uletti, Chief Physician Executive with Community Health Indianapolis Northside. Good morning to you, Doctor.
Good morning. How are you?
I'm doing well. And the question a lot of people want to know is how well will they be doing after they get the vaccine possibly? What are some of the side effects you're hearing about?
Fortunately, here at Community Health Network, we've vaccinated over 5,000 of our own employees over the past 10 days or so, and the vast majority did not have any side effects. I think 4 or 5 had some side effects of feeling like they of having an allergic reaction. We typically watch them for about 15, 20 minutes, and then they go home. Some we provided some minor treatment like Benadryl and so on, but nobody had to be admitted or any severe side effects so far. So luckily, things are looking very good.
All right, you and I were talking during the commercial break, and you said one of the questions you're getting a lot is people are saying, hey, after first responders and what have you, how do I get the vaccine? What's the next step? What do you tell them?
Yeah, and I know everybody's so anxious to get it, which I'm so happy about because it really is the first ray of hope. The federal government has issued guidelines on the sequence of tiering on who gets the vaccine. So first, they want all the healthcare workers and people that work in nursing homes, extended care facilities to get that. Hopefully they'll be done in the next couple of weeks. Then they really want to go to their next tier, which would be people above 70 with health conditions and essential workers that are necessary for the delivery of healthcare. So that'll probably happen in the months of February and March. And then it's going to slowly get to everybody else. So I would imagine for the general population, if you're otherwise healthy and not an essential worker, probably more in the late springtime, probably more like April or so, with the goal of everybody getting it done by May or June or so.
Our next viewer said, how do I know which COVID-19 vaccine is the most effective? Goes on to say, I'm concerned about getting a vaccine that may not do what it's supposed to do.
A very good question. And you always want to make sure that if you're going to go through the risk of getting a vaccine, you're getting the right one. Right now in the United States, only 2 vaccines are approved, both the Pfizer and Moderna. Both have shown very good efficacy, close to 95%. So I'm very comfortable, and we are actually giving both Pfizer or Moderna, whatever we have in stock. So I think both are very safe in terms of their efficacy. Both seem to provide about 90 to 95% chance of not getting the coronavirus if you get the vaccine. So I wouldn't necessarily worry about which one I'm getting because both look very, very good.
So basically, how often would we possibly have to take this vaccine? I know with flu shots, it's once a year. Do we know yet?
Yeah, I mean, that is a big question, and unfortunately, we just don't have the answer yet. So far, things have been looking good. There's no evidence to show we need to take it more than once. But 2 things we don't know. How long does this vaccine actually last for us? Is it 6 months, a year, several years? And will there be any changes in the coronavirus itself that requires a different type of vaccine? We're hoping not, that one time is enough, but it's just too early to tell right now.
And of course, for most of these, you need 2 shots. Another question from a viewer, after receiving the vaccine, is mask wearing still a requirement? What do you say?
Yeah, and actually that's very important. And so taking a vaccine doesn't put this Teflon over you. What the vaccine does is just allows you not to get a severe disease. Right now, we don't know for sure if you can still spread the virus even after the vaccine. You may not get the disease, but you may still be able to spread it. So it's very important to know that you really must continue wearing a mask and take the appropriate precautions until we have more data on that. We think that won't be necessary, but we don't know. So I strongly recommend continuing mask wearing and social distancing. It protects you, but the vaccine doesn't necessarily protect others unless they took the vaccine also.
Very important to remember. Dr. Ram Uletti, thanks for being here and answering the questions. Great job, and thank you very much.